So everyone has experienced where it took too long to get scheduled, to get in with a provider, and then you had to wait for an hour, and you spent 5 minutes with the provider, and didn't get much of an explanation, wasn't clear on the plan of care, didn't know the potential side effects of medicines, didn't really know what's the disease process, what's really happening with me, and didn't know about follow-up, didn't get quick callback regarding lab results, those kind of things. And just the only way, and with the insurance the way it is, and with all the bureaucracy and all the rules, and prior authorizations, cleaning up claims, all these different things that happen behind the scene, the only way to set that up for a family practice to succeed with insurance is to run people through like a factory. And I've always said, if I'm treating folks like a number, fire me. Like, that's not, we want relationships, and we want people to know they're valued, and we want good outcomes. And so we're convinced that basically we're done with the corporate treating people like numbers. We very much appreciate the relationships that we've been able to develop over the last decade in Sanders County, Western Montana, and we're excited to do this new business model.
Good. So question number 2 is, will insurance pay for any labs or radiology services, anything like that?
Okay, yeah, so this is a common question. So Medicare and Medicaid will not pay for the provider services in the clinic, but all of the various insurances will pay for pursuant your deductibles and such. They will pay for whatever is ordered at whatever outside facility, or if we have send out labs, anything other than our provider fees, insurance will cover. If I order an MRI at the hospital, if I order labs, referral, you have to get prior authorizations with VA. But anyway, pursuant to your usual agreement with your insurance for your type of insurance, they'll cover it just the same as if you saw another provider.
Can patients submit itemized invoices to their insurance for reimbursement?
For Medicare and Medicaid, they cannot submit itemized invoices for our services to Medicare or Medicaid, but for other government entities, oftentimes, like TRICARE, oftentimes they will cover it or reimburse, and most private insurance companies will reimburse the patient.
Okay.
Yep.
How much does a self-pay visit or a concierge / membership, what's the plan of cost on that?
Well, right now, for folks that are already established, and established means we've seen you within the past 3 years, it would be $96.11 for a visit. And then for new patients, it's more. For membership, it's $50 a month for adults and $25 a month for people under 18, with a max out of pocket for one household family is $175 a month. Right now, that's, that may change, but that's where we are.
So membership is, what does that include?
Unlimited visits, no more than one per day, but with access to direct line with the provider, my cell phone, and if it's after 8 o'clock at night, probably going to be calling the ER nurse triage or going to the ER if there's an emergency. Every day of the week, we aim to answer a text or a phone call at least within 24 hours, hopefully faster than that, but yeah.
Okay. And how do you sign up for this?
So you can communicate with us through our website, CostnerCareFamilyClinic.com, or you can call the clinic at 406-540-5757, and we'll get information to you, or you can just walk into the clinic and we'll be happy to go through the paperwork and show you what it involves. Yeah.
Very good.